Hello everyone, myself Dr. Ameen Jariya. Today we will be speaking about edema. What is edema? So as we know, basically edema इसको हम अपने नॉर्मल टर्म्स में स्वेलिंग कहते हैं. तो वो कई तरह की होती है और कई सारे पार्ट्स में हम उसको देखते हैं. ताकि इसमें होता क्या basically what happens is blood vessels gets leaked and fluid gets accumulated in the body. So which results in the surrounding tissue leading to swelling or edema. So it can affect basically any part of the body, and one can notice more in hands, legs, arms, feet, ankles, or even in faces. For internal organ also it gets accumulated. So there are different types of edema: peripheral edema, pedal edema, pulmonary edema, lymphedema, and cerebral edema, as well as macular edema. So in peripheral edema, we will have swellings over legs, feet, ankle, and hands. So this could be a sign of problem with circulatory system or kidney. So in pedal edema, the body retains fluid in feet and lower legs. So it is more common in older age or pregnant women, and here the patient will find difficult to move around due to numbness, because numbness will arise in the patient. Then it is pulmonary edema. So here the fluids gets accumulated in lungs, so which makes difficult for breathing, and patients have symptoms like cough and foaming, and sometimes even they have blood. With then, if such things occur, then patient has to be immediately shifted to emergency or for any medical help. Then there is lymphedema. So basically, it is a swelling in lymph nodes in arms, legs. So this is caused by damage to the lymph nodes. So in which the tissues that help filter germs and waste from the body. So there, this fluid starts getting accumulated. So this occurs basically due to cancer or treatments like surgery or radiation. Then there is cerebral edema. So in this, fluid gets accumulated in brain. Then there is macular edema. So it is damage in the blood vessels in the eye, retina. So the fluid gets leaked and which gets built up in the eye. And that's why it is called as macula, which is situated in the center of the retina. So these swellings are due to multiple causes. So the most common is some side effects due to the medications. Then either it may be due to pregnancy or due to some underlying cause such as cardiac causes such as CHF or some kidney disease or liver cirrhosis. So in day-to-day practice, we see many patients with edema and they may have one or the another cause. So now we will discuss some causes as we have mentioned. Then when there is mild edema, so it can be due to sitting or staying in one position for too long. So when we hear sometimes patients come and they say, when I was traveling in bus or train or flight, I got edema, but then it was resolved. So then eating too much salty food, because salt mostly retains fluid with itself. So then you will have edema. Having premenstrual signs and symptoms. So during PMS, there is mostly swelling all over the body. And during pregnancy also, we can see that the female gets pedal edema or some other type of edema. So apart from this, it can be a sign of serious underlying medical condition also, like congestive heart failure or some kidney disease or liver disease or some lymphatic system damage due to underlying cancer or some side effects of the therapy which patient is undergoing, or mostly it can also be due to some long-term protein deficiency. So this also leads to edema, and sometimes even allergic reaction, some severe inflammation, burn, trauma, etc. also causes edema. Interestingly, edema is also helpful in some cases, as more fluid from blood vessels gathers more infection fighting white blood cells in the swollen area. Now coming to the symptoms of edema will depend totally amount of swelling which is there. So the more the edema, the more patient will feel discomfort. So edema due to some infection or inflammation like a mosquito bite or some area would cause no symptoms, because because there will it will be small, so it will either get resolved or it will not cause much problem to the patient. But when there is large allergic reaction such as bee bite, it can cause swelling on the entire arm and it will start causing pain and limit the movements. On the other hand, food allergies or allergy due to medicines can lead to tongue edema or throat edema, then it can be sometimes life threatening because patient will start having breathing difficulty. Now we come to leg edema. So pedal edema, as we know, make the legs feel very heavy and it will be difficult for patient to move around. So severe leg edema can interfere with blood flow and can cause even ulcers of the skin. There is also pitting edema in which there may be an indent or a pit that remains for a while. Like if you will press on the leg, so that there will be a formation of pit. So pressing in some skin types of edema. But if the tissue springs back to its normal shape, then it is called non-pitting edema. The signs that show presence of edema are swelling. So you will have swelling, puffiness in certain areas over the body. So when on pressing onto swollen areas will leave a dimple in the skin. The skin covering over the swollen area appears stretched and shiny, and troubles while walking in the feet where edema is there, and patient's abdominal size will increase. So if there will be a pulmonary edema, then patients will have cough, trouble, difficult breathing, and body parts, stiff joints, patients will have pain. So how can we manage this such edema? So mild edema usually goes on its own. Mostly you don't have to do anything. But like for pedal edema, mild pedal edema, mostly by doing things such as raising the affected area or limb higher than heart, while more severe edema can be treated with drugs that or help the body expel extra fluid in the form of urine. So here we use drug like diuretics to so the patient gets relief. And in the long term management involves treating underlying cause of the swelling, because if if you will not treat the cause, then swelling will reoccur. For example, if the edema is due to allergies, one should take anti-allergy. Or if there is a leg edema due to CHF or liver disease, then those diseases has to be treated with the help of diuretic, also known as water pill. So basically, what it does is it increases urine production, due to which the fluid from the legs can flow back into the blood. If edema occurs due to medication use, then the doctor can uh, manage the doses, or such drugs should be avoided, and whatever alternative is there should be prescribed. So apart from this, some home remedies are also there which can reduce the swelling. So first is moving the affected area. So moving and using the muscles of the swollen area can reduce the swelling, particularly in legs. It may help pump the excess fluid back towards heart. So and if even after this, if you there is no relief, then doctor should be consulted. You should not try to sit or stand for long periods without moving. So it is always advisable to move around or to get up from the chair or sitting position frequently. Elevating the swollen part of the body above the level of heart several times a day. So one can try elevating the affected part of the body while sleeping by putting a pillow under the legs or while lying down, sitting for prolonged periods. Gently massaging over the swollen area also helps in moving the fluid away from the affected area. Compression is wrapping the swollen area using compression stockings. So even stockings are helpful in reducing the edema. And the most important is reducing the salt intake, because salt can lead to fluid retention in the body, hence worsening the condition. So it is always advisable to have less salt. Most importantly is protect the swollen area by keeping them clean moisturized and free from injury, as dry, cracked skin is more prone to scrapes, cuts, and infection. And whenever there is a need, call the doctor immediately. If you have any pain, redness, or heat in a swollen area, or have an open sore, if experience shortness of breath or swelling of any one limb. So hope this will guide you and regarding pedal edema or any type of edema. Thank you.